This is a presentation on perinatal obsessive compulsive disorder, perinatal OCD. My name is Hannah Balow. I am a family nurse practitioner, and I am also certified in perinatal mental health. So just an introduction for myself. My name is Hannah, as I said. My pronouns are she, her, hers. I am a mom to 3 girls. They are now 7, 4, and almost 3. As I said, I'm a family nurse practitioner, and I also teach nurse practitioner students. I'm in the Chicago suburbs. I had postpartum anxiety after my first 2 kids, and then postpartum OCD after my third was born. My OCD subtypes personally were harm, losing control, and false memory. My compulsions most of them were mental compulsions. They were avoiding, checking, um, rumination and mental review was probably the biggest one, and seeking reassurance. My OCD is controlled now, and my own journey to recovery has looked like um, therapy with an OCD therapist, so doing exposure and response prevention therapy, as well as medication and peer support, being in a support group. So, just to go over some information about what OCD is. So, OCD is a mental health disorder that is characterized by repetitive, unwanted, intrusive thoughts, which are the obsessions, and then irrational and excessive urges to do certain actions, which are called the compulsions. So, this graph here of the circle can be helpful in understanding the cycle of OCD. So, first, it starts with an obsessive thought, which creates so much anxiety that then you do a compulsive behavior to bring the level of anxiety down, but that only provides temporary relief. And then the cycle continues unless something is done differently. And some common perinatal OCD themes, really, they can be anything, but some that may be more common in pregnancy and postpartum for OCD themes and thoughts would be contamination, harm, unwanted sexual thoughts, fear of losing control, perfectionism, like, am I doing everything perfect as a mom or as a parent? And moral or religious thoughts or doubts or fears. So, as I said, the thoughts and compulsions really can be anything, um, but they usually attack the things that someone cares mostly deeply about. And as I also said, compulsions can all be mental, so no one would see what is going on, such as ruminating, which would be like a mental review, or ruminating, thinking over and over something, whether that be an event or a thought in the future or in the past, a fear or doubt. And then avoiding could be a compulsion as well. So it's not always going to be very obvious to the person themselves that is having that may be having OCD, and definitely is not always obvious or clear to people around them or medical providers. So, understanding perinatal OCD, these statistics were saying that around 3 to 5% of new mothers or birthing parents and some new fathers would experience the symptoms of OCD. But the newer studies are suggesting that these percentages are much higher, probably close to about 8 to 17%. The rates of perinatal OCD are higher among women or parents who had an OCD diagnosis prior to giving birth, or who have had a family member, like a close relative who has OCD. So, what causes perinatal OCD? So um, there are it's really a mix of hormonal and medical factors that are causing OCD in the perinatal period. All OCD is a neurobiological condition. So research suggests that OCD involves problems in communication between the front part of the brain and then the deeper structures of the brain. Um, there is a neurotransmitter called serotonin that is used to help communication between the different parts of the brain. And it is seen that either the serotonin is, there is not enough serotonin, or um, it is not being used, or it's not as available as it should be in people that are experiencing OCD symptoms. So yeah, so the OCD brain struggles with sending these messages between the different parts of the brain. Thankfully, OCD is really treatable. And but just to show you information about what is going on in a brain that has OCD, really the point of this slide is to show you that um, this is not your fault. This is not something that you could have prevented. Um, This is a slide from the book Brain Lock, Free Yourself from Obsessive Compulsive Behavior, by Dr. Jeffrey Schwartz, which is a really great book on understanding what is going on in the brain when someone has OCD, and understanding how we can make changes in the way our brain is communicating and functioning. So these are scans of two different patients. Um, the patient on the left, that scan on the left, is just a normal control patient. They do not have OCD. And the patient on the right is someone who does have OCD. These patients are both exposed to the exact same thing. But as you can see, the patient on the right, their brain really lights up in terms of so much activity that is going on in their brains as compared to the patient that does not have OCD. So again, this is showing this is not your fault. There is something that is actually going on in your brain, but thankfully OCD is very treatable. So some possible exacerbating factors for OCD would be pain, lack of sleep, childcare or relationship stress, or really any big life changes or stress, even if that is good stress. Very stressful situations can exacerbate the OCD symptoms. Also, unresolved grief or attachment with your own mother, a history of childhood sexual abuse, maybe returning to work, or just a big shift, whether that be you have been used to working outside of the home and now you are staying home full time, or you're staying home part time with a child, or you're going back to work and you are figuring out childcare. Whatever that may be, that can be a very stressful time of just a lot of changes. So treatment for OCD, as I said, OCD is thankfully really treatable. So OCD is typically treated with therapy and or medication. It's important to note that what works for one person for OCD treatment may not be exactly the same that works for another person. But having providers who really understand OCD, especially in the perinatal period, that is so, so important. A lot of providers, especially primary care providers, may not be as aware of OCD if it is not the typical OCD that may be more contamination thoughts or compulsions that can be seen. So I'll share a lot of resources and some information about how to talk to your provider too. But it is really important to have a provider who understands both the perinatal period and OCD. Some great resources in terms of finding providers. On Postpartum Support International's website, the provider directory is great, and you can put in where you live, and that will pull up perinatal providers in your area, therapists and prescribers, and then you could see if any of them are have specialties of OCD, and I believe you could even filter within those perinatal providers. I believe you can filter for OCD providers as well. Another good resource is the International OCD Foundation's website. And they also have a provider directory for specifically OCD providers, whether that be a therapist or a prescriber or in some areas, support groups. So therapy for OCD would be typically cognitive behavioral therapy with exposure and response prevention therapy. That ERP, exposure and response prevention piece, is really the gold standard in terms of therapy for OCD. It has been found to be very effective to do exposure and response prevention. And that is exposure and response prevention is exposing yourself to your fears and to your OCD thoughts, but not responding with a compulsion. So typically with a therapist, that's done very gradually. You will write out kind of a hierarchy of what your OCD thoughts are and work from the least distressing to the most distressing, and really work on very specifically for yourself what is the obsession, and then what is the compulsion or all of the compulsions. Are there mental reviews or avoiding that's going on that may not be so easily seen or evident? So exposure and response prevention is very effective. Dialectical behavioral therapy could also be used. Medication can be a great option for some people with OCD. Some people may benefit just from therapy and they may not need to take medication. Some people may benefit a lot from medication and maybe not need too much in terms of therapy. So each person could be a little bit different. The thing to note, so for some people it might be therapy and medication. For some people it may be one or the other, but probably not just medication. For most people with OCD, they would really benefit from a therapist as well. Medications that are most prescribed for OCD would be SSRIs, which are selective serotonin reuptake inhibitors. Some common ones would be like Zoloft, Lexapro. There are many options for SSRIs and SNRIs. So they're both targeting the serotonin. The SNRIs, that class, is also targeting the norepinephrine. So that's a serotonin and norepinephrine reuptake inhibitors. So this is definitely medication needs to be prescribed by a provider who is very familiar with OCD, as well as OCD in the perinatal period. And something to note with medications for people that are taking that for OCD, medications may need to be at a higher dose than, say, someone who is taking one of these medications just for anxiety or just for depression. Often the medication will need to be a higher dose for OCD. And so some other resources here that I wanted to highlight. As I said, the International OCD Foundation website, which is there, www.iocdf.org, is a great resource for information on OCD. They also have a lot of ways to get connected to the OCD community that are free. They have virtual like kind of Q&A sessions or educational sessions on that they'll have on their Facebook page that you can join in. You can put your questions in the chat and experts will answer those, or just they provide a lot of different just education on different topics related to OCD. As I said, they also have that provider directory, which is really helpful. They have conferences too. They have virtual conferences. So just an amazing wealth of information in terms of OCD support and recovery, and just really encouraging information. And NoCD is an app. So it is virtual telehealth therapy specifically for OCD, and specifically for exposure and response prevention, I believe. They all of their therapists would do ERP. So their website would be treatmyocd.com. And then some other resources. Good Moms Have Scary Thoughts is not specific to OCD, but it's a great resource for pregnant or postpartum moms or birthing parents. It is a really easy read. It is a lot of pictures and not a lot of words, but it's a really impactful, very relatable of what parents go through, and not even just the birthing parent, but the partner too, in just the some of the challenging circumstances. But it's a book that will make you laugh and cry probably. And I personally have liked the mindfulness workbook for OCD as well. And then if you're looking for resources for a family member who is trying to understand OCD, this book, When a Family Member Has OCD, is a really good resource. So some additional resources, and these are things that I just found very helpful on my own OCD journey. On the left here are a few therapists who are wonderful OCD therapists. They all have social media presence and platforms. Jenna Overbaugh is an OCD therapist with lived experience with postpartum OCD. She has online classes and courses, workshops, and just really great, solid information, specifically about exposure and response prevention for OCD. She has a podcast. Christina Orlova, also an OCD therapist, great online community, online groups. She has a podcast too. And then Kimberly Quinlan is another OCD therapist, just really amazing, encouraging. She has the self-compassion workbook for OCD, which I also have really liked, to just practice self-compassion on the road to recovery from OCD. To really incorporate that is very powerful. The OCD Stories podcast is a great, great podcast. It features some of the world's best OCD therapists, psychiatrists, psychologists, and then also people come on sharing their own personal stories of recovery from OCD. So it was very helpful for me in going through kind of the beginning stages of recovery from OCD to listen to these stories, and really helped me to not feel alone, because I didn't know anyone who had OCD at the time that I was diagnosed. So that was a really helpful resource. In terms of books, there are so many that, I mean, I could list so many, but just a couple. Freedom from Obsessive Compulsive Disorder by Dr. Jonathan Grayson is wonderful. It's a bigger book. Overcoming Unwanted Intrusive Thoughts was a little bit of an easier and shorter read for me. It really helps you to understand what is going on in your brain, and what you can do to reroute these signals that your brain is firing away, and really what you can do to reroute those, and how your brain does respond to that process of retraining and rerouting. So in terms of talking to your provider, there is a really great perinatal mental health discussion tool on PSI's website. So it would be on PSI's website, then you go to store and then discussion tool. This is something that it is just kind of like a conversation starter that you could take to your provider. I think it's really helpful because it can be really hard to say these scary and intrusive thoughts to anyone, and it can be very hard to say that to a provider. But when you are able to show them, like, this is a tool that I found, a discussion tool that I found from Postpartum Support International. And I was encouraged that it would be a good thing to look over and fill it out. And this is kind of where I am. So there are questions about anxiety, depression, but also about intrusive thoughts, which would be OCD. Not everyone who has intrusive thoughts has OCD. Actually, most intrusive thoughts are very, very common in the perinatal population. They actually are common with everyone, but it is not uncommon to have intrusive thoughts. But it would really be based on a diagnosis of OCD would be based on how much time the thoughts, the obsessions and or compulsions are taking. So it would be diagnosable at if it's taking an hour or more per day, and if it is very distressing. So that is what a provider would be looking at in terms of diagnosing how distressing it is and how much time it is taking. So this perinatal mental health discussion tool can be a really great resource to take into a provider if you are needing help with how to start that conversation. Again, as I said, you can just print the discussion tool off of the Postpartum Support International website. Go to the PSI website store and then discussion tool. You can print it off, and then just you check off the boxes of the question. So this is not like a screening tool. It's not going to be used to diagnose. It is just like a conversation starter and discussion tool with your provider. So thank you so much for listening and for your time. So all of this information is from Postpartum Support International and the International OCD Foundation. I also want to share that Postpartum Support International has two different options for support groups um, for parents who may be experiencing OCD symptoms. You do not need to have a diagnosis of OCD, but we have, and all of the support groups are listed on Postpartum Support International's website as well. There is a group that meets on Tuesdays for perinatal OCD. So that would be pregnant or postpartum within the first 2 years of giving birth parents with OCD. So the birthing parents. And then there is also a group that meets on every other Friday, I believe, for any parents. So moms or dads, birthing parents or partners with OCD symptoms. Again, you don't need to have a diagnosis of OCD. And you are welcome to join a support group to be able to talk more about getting more education and getting support from others who are going through the same journey. So thank you so much for your time. I really appreciate it, and I hope this was helpful. Thank you.